Welcome to The Explainer. Today, we're decoding essential orthopedic imaging patterns. Got a ton to memorize in like no time? Yeah, we've all been there. This guide's gonna help lock in the high-yield patterns you absolutely have to know. Okay, let's get into it, starting with a couple of classic knee injuries. First up, patella dislocation. The key thing to remember, it almost always moves laterally. And it's a similar story for tibial plateau fractures. The lateral side is the most common spot. So the key for both of these knee patterns, just think lateral, lateral, lateral. All right, let's switch gears to AVN. This is a condition you really don't want to miss. So what is it? Simply put, it's bone death from a lack of blood supply. In the wrist, a proximal scaphoid fracture, that's a super high risk for AVN. Now in the hip, a displaced femoral head is a major predictor of AVN. So to recap AVN, you're checking the proximal scaphoid and any femoral head displacement. Okay, let's decode a couple of patterns you'll definitely see in wrist images. If you see a slack wrist, you're going to want to look for an associated DISI deformity. So what is slack? It's a pattern of arthritis that often causes that DSII deformity. With de Quervain's, the action is all in the first dorsal compartment. That's where the inflammation is. So a perfect contrast, right? One wrist issue is structural, the other's inflammatory. Let's move to the spine now and see how two conditions present very differently. Notice the key difference here. TB spine spares the disc, while osteoid osteoma causes scoliosis. So just remember, these two totally unique signposts when you're looking at the spine. And just like that, your pattern recognition toolkit is now officially upgraded. So that was a super quick run through the knee, AVN risks, the wrist, and the spine. See, pattern recognition is an absolute superpower. Now go put it to use.